This presentation is all about Betty Neuman and the Neuman system model. Group members include Alexis Lundstrom, Jacqueline Ryan, Kate Brown, and Naomi Moore. And pictured on the left is Betty Neuman herself, who is currently 97 years old. A quick biography about Betty Neuman. She was born on September 11, 1924 in Lowell, Ohio. She was raised on a farm with two brothers, one older, one younger. Unfortunately, her father fell ill and passed away at the age of 36, and Betty was his primary caregiver. And her mother was a self-educated midwife. Both her mother being a midwife and the experience of being her father's caregiver inspired Betty to become a nurse. She's also credited her life on the farm for teaching her to become self-reliant and responsible, which has helped her throughout her career as a nurse. Neuman's education and career experience. Betty Neuman earned her nursing diploma from the People's Hospital School of Nursing in 1947. She earned her BSN from UCLA, where she also earned her master's degree in mental health and public health consultation in 1966. She earned her doctorate in clinical psychology from Pacific Northwestern University in 1985. Betty has worn many different hats throughout her career, including hospital staff nurse, head nurse, school nurse, industrial nurse, consultant, and nursing instructor. As a nursing instructor, Betty has taught med-surg nursing, critical care nursing, and communicable disease nursing at the University of South California Medical Center in LA, and at multiple other colleges in both Ohio and West Virginia. Philosophical underpinnings of Betty Neuman's theory. The Neuman's systems model is based on her belief that human beings are a client system, consisting of 5 different variables: physiological, psychological, sociocultural, developmental, and spiritual. Neuman referenced multiple concepts and theories from different disciplines as she developed her own holistic theory. 3 examples of this is Neuman referenced Chardin and Cornu's idea that parts of a system are viewed as a whole rather than separate pieces. Also, the general adaptation syndrome influenced Neuman's model with the belief that the body will experience 3 different stages in order to maintain homeostasis while under stress. These 3 stages are alarm, resistance, and exhaustion. Lastly, Neuman has referenced the general system theory in her model by sharing the idea that energy is required to maintain an organizational state, and that a problem in one system will affect other systems as well. This slide includes a video of Betty Neuman herself discussing the Neuman system model and how she still utilizes it to this day, and how she thinks it's vital for nurses to incorporate this into their practice. So if you could watch from 4 minutes to 6 minutes and 20 seconds, that would be great. We can now begin to analyze Betty Neuman's theory. So this theory is a holistic approach to nursing that focuses on how the patient responds to environmental stressors. This theory views the patient from a multidimensional perspective, which consists of a basic core that can be broken down by different types of stressors that will eventually lead to illness. If you look to the bottom left of the screen, you can see a diagram that helps show the lines of defense. The core are the survival factors, which include maintaining temperature, breathing, the function of organs, ego, and genetic structure. The flexible line of defense, which is the outermost ring, serves as a protective buffer from the patient's normal or stable state that prevents the invasion of stressors and keeps the patient free from stressor reactions or symptoms of stress. This line keeps the system free from stressors, but is dependent on the amount of sleep, nutritional status, and the quality and quantity of stress the person experiences. If this line of defense were to fail, the lines of resistance are then activated. The middle ring represents the normal line of defense, which is the patient's normal or usual wellness state. This is the usual level of wellness that can vary from patient to patient. It is dynamic and constantly changing, and it responds and copes with the environment. The normal line of defense is the ability of an individual to maintain a healthy state free from stressors that would cause illness. Lastly, the innermost ring, or the line of resistance, is involuntarily activated when a stressor invades the normal line of defense. It attempts to stabilize the client system, or the patient, and foster a return to the normal line of defense, the last boundary of defense that protects the basic structure. This defense starts when the stressor has invaded the normal line of defense and enters the system. If the lines of resistance are effective, then it can reconstitute the normal system and the client will be fine. However, if the line of resistance is not effective, then Neuman theorizes that death will eventually occur. In continuing theory analysis, Neuman's systems model is centered on the patient's relationship to three different types of stressors and the effects it has on the disease process. Interpersonal stressors are within an individual. Interpersonal stressors are between individuals. And extrapersonal factors are occurring outside of the individual. When looking at a holistic view of patients, it is analyzed by factors such as physiological, which are functions of the body, psychological, which are mental processes and coping mechanisms, sociocultural, referring to interactions with people and cultural influences, developmental, which are age-related factors, spiritual, beliefs through faith or feeling of something higher than oneself. The nurse's role is to keep the system's stability by using three levels of prevention. These three levels of prevention are primary, secondary, and tertiary. Primary interventions occur before the stressor affects the system. Secondary interventions occur after the stressor is involved, and tertiary interventions occur after the stressor is being treated. Neuman's model depicts concepts in nursing as health, a holistic view of wellness. This includes free from stressors. Health is assessed by variables such as intrapersonal, interpersonal, and extrapersonal stressors. Nursing, whose role is to assist in regaining a state of wellness. This is done through primary, secondary, and tertiary interventions. The patient, who is impacted by variables of stressors, such as sociocultural, physiological, spiritual, psychological, and developmental stressors. The environment, which has internal and external factors that impact wellness. Here is another diagram that can help you visually understand the framework for Neuman's systems model. This slide delves into the practical uses of Betty Neuman's theory. The Neuman systems model has been used extensively in nursing, both in education, practice, and administration. It presents a holistic framework for nurses providing care for their patients. An example of this theory being used was in a study completed by Isaac and Ersi in 2020. In this study, there were 160 hemodialysis patients in Turkey that participated. Isaac and Ersi explored if the home care based on the Neuman systems model could reduce the severity of the physical and psychological symptoms, and if it could increase the life quality of patients undergoing hemodialysis in the home care setting. Patients who were undergoing hemodialysis were treated by home care nurses in their homes using Neuman's systems model. This means that the home care nurses were treating these patients physiologically, psychologically, socioculturally, and spiritually. The results showed that using the Neuman systems model helped to reduce the symptoms and increase the quality of life of these patients. When researching this theory's testability, we looked at a study that focused on modifying stressors using Betty Neuman's system model in coronary artery bypass graft patients. A randomized clinical trial was conducted with 2 groups of patients undergoing a CABG, with a total of 64 patients in the study. The method of data collection utilized by the researcher was a revised cardiac surgery stressor scale, which consisted of 37 questions. Interventions were performed by the researcher according to the format of the Neuman model, which included the investigation of the stressors and the determination of the goals and strategies for the actions. Results of the study showed a positive effect in reducing stressors of patients undergoing a CABG when utilizing the Neuman's Care program. Theories parsimony. The model is very complex and it functions in many ways. It focuses on a broad scope. The model is not considered to be parsimonious because the description of the model's parts can be confusing. However, according to McEwen and Willis in 2019, Neuman and Fawcett clarify the interactions among parts of the model and facilitate its use through developing intermediate diagrams. The definitions and assumptions are clear and well organized in Neuman's most recent edition. Lastly, we'll take a look at a middle range theory that utilized Betty Neuman's system model. The Adolescent Vulnerability to Risk Behaviors by Mary Cassell, RN BSN, utilized Betty Neuman's system model as a basis for the middle range theory of adolescent vulnerability to risk behaviors. This theory was adapted from the Neuman systems model, and this adolescent-specific theory describes the layers of defense and resistance that surround and protect the 5 inner core variables of the adolescent from external stressors. High-risk behaviors can occur when the layers of defense fail to protect the adolescents. The 5 inner core variables of the adolescents are external stressors, developmental assets, role models, peer influence, and parent functioning. Here are our references that we have used. If you have any questions, feel free to reach out. We had a great time doing this project, and we hope you guys did as well. Thank you.